It's no surprise that periodontal disease is so prevalent. It really is caused by a bacterial infection that you can't clean very well at home.
The toothbrush, great tool, but it can only get a couple millimeters below the gum tissue. Same with flossing, doesn't get much further than that.
The problem with toothbrushes, rinses, and flosses is that they work on the surface. They do not work below the gum line.
When you have bleeding gums and you have subgingival tartar and bacteria, just brushing and flossing isn't going to treat the problem. It needs to be attacked subgingivally or underneath the gum tissue.
You cannot control all the bacteria. You don't kill all the bacteria. But what you do is you change the microenvironment.
So between the tooth and the gums is where the bacteria hide. And as soon as they grow into a colony, a community we call a biofilm, it's really difficult to manage it. So that's why the Perio tray is nice. The tray gets medication really deep under the gums where you need it, where your toothbrush, rinse, and floss can't reach.
The depths of the pocket are very difficult for not only the dentist to get to, but for the patient to treat with almost any other method.
The tray is a delivery device. The tray is like a syringe that delivers insulin for a diabetic. It's the insulin that helps the diabetic. The tray just delivers the doctor-selected medication down into and holds it in that infected area long enough for the medicine to work.
And the tray is unique. It's unique for you. So your dentist or hygienist will take measurements in your mouth and send that to one of the dental laboratories, and they'll create a tray with an internal peripheral seal. And that internal peripheral seal corresponds to measurements from your dentist or hygienist, and it's made for every single tooth. That seal corresponds to your unique conditions. And that seal and the extensions beyond it work like a gasket. They prevent the medication from leaking out all over the mouth, and they direct it very deep into the periodontal pocket.
The action of the periodontal gel causing a positive pressure in the tray forces that medication to the bottom of the sulcus, and we will get treatment all the way down, whatever their depth may be.
In the beginning stage of treatment, you're going to be asked to use the trays 2, 3, or 4 times a day. And that is because each tray application is going to work against that bacterial community. So imagine it's like an onion, and you're applying the medication with the Perio tray deep into the pocket. You're going to peel off that onion. Next application, peel off the onion. Pretty soon, your body has a chance to heal because you're fighting that bacterial community. Then long-term use, for most patients it's 1 time a day, 10 to 15 minutes. Long-term use gives you a way to manage the bacteria on an ongoing basis.
These trays are needed so that the patients can have them at home to do on a daily basis, take their health into their own control, and really get that medicine down to where it's needed.
You want a healthy oral flora, and this is what the tray delivery is going to be able to help you accomplish.